the biggest impediment to people actually mastering anatomy is simply the fact that the words are so big and then so unfamiliar. And it really puts a lot of people off when big unfamiliar words does not mean really difficult concepts. It just means big unfamiliar words is all it does. So most of anatomy, the prefixes, roots, and suffixes that you will use for anatomy are in Latin or Greek. And most of us do not speak ancient Greek, correct? Even if you are Greek, you don't speak this kind of Greek. And most of us did not take Latin in high school because the girls were cuter in French, or you lived in Texas and Spanish was more useful, right? How many of you guys took Latin in high school? Anybody? See, make your kids take Latin in high school. It's good for them. It's like castor oil. So what we are going to do first is to try to get over this impediment by forcing you to learn the most common prefixes, roots, and suffixes that are used in anatomy. This is not comprehensive. It's certainly not all that we're going to use, but it'll get you started. How is it useful? You're reading, and you see the word hematocytoblast, and you're like, oh, I am done, right? I am just so done. But you don't have to be done, because it's just like everything else. You can figure it out in context with the knowledge that you already have. So if, for instance, you knew when you got to that part of the cardiovascular system chapter, if you knew that hemato meant blood, and cyto, of course, means cell, and blast means bud or precursor, right? Okay. So then you could probably figure out, oh, okay, I'm reading in the cardiovascular system chapter, and we're talking about bone marrow. A hematocytoblast is probably the blood cell precursor in the bone marrow that makes blood cells. Does that make sense? And that's how you get the confidence to continue reading when you are inevitably going to come up with one unfamiliar term after another after another. So what I'm going to have you guys do is I'm going to have you learn these prefixes, roots, and suffixes, and then when you have your first quiz next Thursday, I am going to throw unfamiliar words at you that are composed of familiar roots and ask you if you can figure out what you think it means, right? Right? Does that make sense? So, and it will give you confidence for the entire semester. For instance, if you go into lab, and a lot of people don't do this first, but you go into lab, and I have taught you, whether you already knew or not, that the word brachio refers to arm, and the root brachio refers to arm, and the root cephalic refers to head. And then you're in lab, and you're looking for the brachiocephalic vein. You are not going to be the Yahoo who's looking behind the knee, are you? No, you're going to be looking and you're like, I don't know exactly where it is, but it should be here-ish, right? And never underestimate that little bit of confidence that will actually get you from one step to the next. So whenever possible, I will teach you the meanings of roots so that you can hold on to them and then use it and apply it to other situations. Will you ever know every word in anatomy? Well, if you do, you are a completely unprecedented human, because I've never met anyone who knows all of the words in anatomy. But we have so much background information that we can figure out new terminology better and better and better. So that's going to be part of your first quiz, right? Those prefixes, roots, and suffixes. The other part of your first quiz is going to be this first set of notes. This first set of notes right here. So the first thing on the first set of notes is just looking at that first assignment, download, print, and study the prefixes, roots, and suffixes. Most of them are Latin or Greek. We'll make new terms, meaningful terms. By the way, I won't test you off of the terms that are on the sheet. I'll test you off of unfamiliar terms, generally speaking. The terms on the sheet are just examples so that you can see how it's relevant. Okay, so that'll be the first, and then the rest of the first quiz will be over the rest of this set of material, this first set of notes. Does that make sense? This first set of notes, and also the entire first bit of the semester. The first test is the easiest test of the entire semester, and usually one of the lowest scores of the entire semester, because at the same time that you are learning the material, you are figuring out how to study for the class. Okay, I'm not saying people flunk left, right, and center. I'm saying that if you are a 100% student, you might start out as an 87% on this first test, but you can work on that. It takes a lot of studying. Okay, so let's talk about the approach to anatomy that we do in this class and then other approaches that exist. I love anatomy. I think it's fascinating. I understand and acknowledge that it's hard. It certainly is. I'm really passionate about it. I hope that some of that becomes contagious. Usually easier to learn when things are interesting and someone is interested in them. So the way that we approach anatomy, which is the study of the structure of the human body, Anatos implies to cut. You can't see everything on an external view, so you're going to have to get some internal views. But before we get to that, we start off with microscopic anatomy. And microscopic anatomy, in 1610, you did mostly cytology, which is the study of cells and cell structure and cell function. We're not going to do that in this class. We're going to start with histology. Anybody know what histology is? Yeah, it's the study of tissues. A lot of people hate histology. I'll do my dead level best to make it really interesting for you guys. Sometimes I'm successful and sometimes I'm not. Histology is microscopic study of tissues. Why on earth do you do it? Because it's really relevant. So whereas you can see a heart, you have trouble understanding how the heart functions if you don't know the microscopic tissues that it's made of. And you certainly won't be able to understand physiology if you don't understand what cardiac muscle actually looks like under a microscope and why it looks that way. So we do microscopy and histology because it's relevant. In addition, just to make you have a tiny bit more respect for histology, it is only the histologist who can be a pathologist. So let me just talk to you about something that happens in people's lives. It's inevitable that you will know someone in your life with cancer. It's just inevitable. So someone goes in and they have a lump in the breast and they do a biopsy of the tissue, yes? How can you tell whether that is normal breast tissue or metastatic breast cancer? How can you tell? It's histology, because you know what the tissue looks like, right? And you know what is abnormal compared to what the tissue looks like. Does that make sense? So it's all based in histology. And here's the other fascinating thing that it took me like an embarrassingly long time to learn. How the heck can you ever tell when someone says, oh, you've actually got a brain tumor, but it metastasized from your lungs? How do people know that it metastasized from your lungs and didn't originate in the brain? Well, it's because, interestingly, what you will actually see is weird-looking lung cells that are actually growing within your brain tissue. And how the hell do you know that? Because you know histology, right? Does that make sense? So while it's a little harder to grasp, because especially with people who are kinesthetic, like she said that she was, you need to put your hands on things, a little harder to grasp because, of course, it's microscopic little slices of things that you have to put in relevant places in the body. My commitment to you is to try to continue to make it relevant throughout the semester so that it doesn't become completely disconnected from everything and something you only cover once. It may not be your favorite part of the semester. After we get past histology, we start on the systems, the body systems. And so we will start doing gross anatomy. And gross anatomy is anatomy that you don't need a microscope to see. It's visible with the naked eye. Generally, it starts at the organ level, because although you can't see cardiac muscle, you can certainly see a heart, right? And then you can see the entire cardiovascular system. So visible with the naked eye. Sometimes it involves dissection. You guys don't do cadaver dissection because you really don't have that kind of skill yet, right? It's a really, really valuable resource. It's very precious, and we have to be very careful about how we use it. You get to observe, put your fingers in, touch, understand prosected cadavers that we have prepared for you. They are ridiculous amounts of work. I expect ridiculous amounts of respect for them. These people gave their bodies willingly, and it's probably about 100 hours of preparation before any cadaver gets to you to be studied. So be really careful with them. It's not like you can't touch them, and you certainly should touch them, because that kinesthetic knowledge is something that's hard to forget, right? You determine the textures between things, and they really sort of make you understand. The texture of the lungs really tells you about something of the structure of the lungs. So you won't do dissection of cadavers, but you will do some dissections. You will do a cow eye dissection. You will do a sheep brain dissection, unless I can find bigger brains. I'm always hitting up the slaughterhouses to see if I can get stuff for you guys. They're like, you want a what? And I'm like, pig lungs. They're like, why? I'm just like, just do you have any? Just, can I have them? That's all. You will do a heart as well. You will do a bone dissection so you can see bone marrow and that kind of stuff. The heart, I usually try to get you guys fresh pig hearts, which pig hearts are damn near identical to human hearts. They're almost the same size. They have all the same branching, except for one little exception on the vessels. And I don't know if you guys know this, but surgeons actually practice on pig hearts, right? So I'll try to get you guys some fresh pig hearts from the slaughterhouse to practice with. It's a little gross, but it's also super interesting because the textures of preserved tissues are really different than the textures of fresh tissues. So I try to do that stuff, and you do get the opportunity to dissect things. If you love dissecting because you are a super weirdo like I am, remember that there will be further opportunities for you. The pro section class exists in the future if you're a really successful anatomy student, right? So, and that is undergraduate students that do an entire cadaver prosection. So it generally involves dissection. So when we get into gross anatomy, there's two different really common ways to approach gross anatomy. There's the way that's generally done at the undergraduate level, which is how we're going to do it, which is systemic anatomy. And here's how it works. After you get past histology, we start to do one body system at a time. And that has advantages and disadvantages. Here's what we do. So we'll do the skeletal system, and by putting it together, you'll start to sort of understand how it functions, right? You're going to see the two bones come together and actually form a joint right here. And you're like, okay, I see, well, that one looks like it would bend that way, right? So after we do the skeletal system, then we'll lay the muscular system over it because it attaches to the skeletal muscle design. That's sort of the natural next thing. Then we'll do the nervous system because the nerves innervate the muscles and make them function, right? And then we do other body systems. The objective of doing it that way is that by putting the body systems on top of one another, you get an implied structure-function relationship. Does that make sense? And I always sprinkle physiology into the anatomy because just terminology is dry as a bone, and it doesn't stick, right? If you don't understand why you have to know something, then it's really hard to convince your brain to remember it, right? Whereas when you guys start looking at the skeleton or the skull in 2 weeks in lab, you have to learn like a ridiculous number of freaking holes in the skull. And you're, what the hell? Why do I have to learn all these holes in the skull? Well, what if I tell you that that hole that's called the optic foramen is the hole that your optic nerve goes through from your brain to actually get the sensory information from your eyes? Then you're like, oh, now I care, right? So I put in enough phys to make the anatomy relevant because it actually helps with retention. Does that make sense? Okay, so that's systemic anatomy. That's how we do it. That's how almost all undergraduate anatomy classes do it. But if, for instance, you go to med school or PA school after this, you're going to take anatomy again because they do a whole different approach. And the whole different approach is because of the different goals. So if you go to U and take their med school or PA school or PT school anatomy, they do regional anatomy. So instead of doing skeletal system, for instance, they would start out with upper limb anatomy. And the upper limb anatomy, you would learn all of the ligaments, the tendons, the musculature, the nerve, and the vessels of the upper limb. Can you see how that might be more relevant to someone who was going to manipulate a particular portion of the body than just systemic anatomy? But the disadvantage to doing it that way is that you really do not get that implied structure-function relationship, right? There's like, this is where all the parts are relative to one another, but you don't see it how it fits into the whole. So there are strengths and weaknesses of doing both. And actually, if you ended up in med school, you would actually have needed both approaches, really, ideally. So interestingly, at the U, their undergraduate anatomy is also a regional anatomy. Mark Nielsen just loves to teach it that way. He's one of the few people in the country that teaches regional anatomy at an undergraduate level. And it has benefits. It's a phenomenal class. It also has weaknesses. They end up not knowing a damn thing about how the nervous system controls all of the tissues, but they have a phenomenal understanding of how the muscles work, for instance, in the upper limb or in the hand. So there's always more anatomy to learn, and there's always more ways to approach it. So this is the way that we do it, in part because it feeds into physiology, and I teach physiology too, and I really need you to have that structural functional relationship. And then there are other branches of anatomy. I don't really cover them very much, in part because I don't know that much about them, but they're interesting, and sometimes I will refer to them. One of them is surface anatomy. So you guys will, if you end up being clinicians, you will be way better at this than I ever am. Surface anatomy is using external landmarks to figure out where internal structures are. So for instance, the spinal cord proper ends about L1 or L2, right? So you feel down to L1 or L2 to know that you're not going to hit a spinal cord, right, when you do a spinal tap, right? So you're using external landmarks. Or when you go to the doctor and they take the stethoscope and they move up your left boob, that is because the heart actually contacts the anterior wall of the chest between ribs 3 and 4 on the left side, right? Or these two, if you still can feel them after Christmas and Thanksgiving, right? These two anterior superior iliac spines, if you draw a line across them, your urinary bladder is below there, right? Does that make sense? And of course, you can use external landmarks to figure out where your appendix is and those kinds of things. So that's surface anatomy. I'm not very good at it. Developmental anatomy and embryology are kind of related to one another. Those are how you got to look how you look as an adult, right? Coming from a single-celled zygote. It's pretty fascinating when it's super relevant. I talk about it. I don't talk about it a whole lot. It's really relevant with how the brain comes together. It's really relevant with the reproductive system because males and females started out with identical reproductive anatomy. And then developmental anatomy changes. And because of that, you can start to understand how differences from normal developmental anatomy occurs, like intersex situations. So if you teach the development, you start to understand the anatomical variability. Okay, and then sometimes things go wrong. Usually when things go wrong, it's a phys problem, not an anatomy problem, but there are some pathological anatomy situations, like scoliosis, right? That's an anatomical problem that causes a pathology. Or have you guys heard of a cleft palate? Have you heard of that? So your two palatine bones and your two maxillary bones form the palate. And sometimes they're supposed to, everybody starts out with two of them, and they're supposed to form a suture right down the middle. Sometimes that doesn't occur, and you end up with a hole that can go all the way up to your nose, right? That makes sense? So those are pathological anatomy conditions. I will talk about those when they seem relevant and interesting. That's not my specialty, but it does add some flavor to the class, right? And then if we do anatomy really well, what should start happening is you should start thinking, I look at that structure and I think it probably works like this. And that means I've been successful, right? Because then by the time you get to physiology, I can remind you of the anatomy that helps you understand the phys. So it all ends up being one story instead of two. Do you guys know that in other states, they teach A and P separate, or A and P together in two separate courses? A and P1, I think, goes through cardiovascular system, and then A and P2 does the rest of the body systems. Do you guys know that everybody argues about the proper way to do it? Even that the A and P professors were constantly arguing about the proper way to do it. I've done it both ways. In Texas, they teach A and P1 and A and P2. And so you learn, for instance, about the anatomy of the skeletal system and the physiology of the skeletal system all at the same time. And when I left there, I thought that this was the wrong way to do it. And now I think this is the right way to do it. Because you actually get a lot more A when you separate them. Because how long can you talk about the P? Forever, right? There's like so much to the functionality. So I think you end up getting a much stronger basis of anatomy by actually separating them. So anatomy will naturally lead to physiology. Okay. How many minutes do I have left? 3 minutes. Okay, so gross anatomy. Let me just introduce you to the gross anatomy and how we're going to start talking about this. So the first thing that we're going to have to assume is that we have to assume not only some common terminologies, but also some common assumptions about what I mean when I'm talking about directionality or parts of the body. So let's say that you took a patient history, but then your office did not actually have the expertise to do what was needed. Then you have to send the patient history on to someone else. And if you've discovered something, you have to say, okay, well, it was in this location, right? You have to send it on to someone else. And then that person has to be able to understand what you mean. So there has to be a common set of assumptions, even if the person's in another country. So the first thing is that we always have to talk about the human body with a common set of assumptions, and the common set of assumptions starts with this. This is what is called anatomic position. And no matter what my body position is, this is the front part of my body. Even if I'm laying down, I'm upside down, I'm standing on my head, this is the front of my body, also called the ventral surface. And then palms forward, toes forward, face forward. This is not comfortable, but this is anatomical position. So this is the anterior surface of my forearm. This is the anterior surface of my hand. And that's going to be really important because whether you are a special snowflake that your mother loves and thinks is special, or you are your cat, you have the same muscles on the anterior surface of the forelimb. Does that make sense? So, anatomic position standing up is palms forward, But then sometimes, of course, your patients are not standing up, right? So this is anatomical position. Does anybody know what anatomical position is called if I'm laying on my back? Palms up. Supine, yes. Laying on my belly. Palms still go toward the belly. That's still anatomic position. Last thing I want to address is why, because this is not comfortable. The why is because we are a mammal. Our anatomy is like every other mammal. We are related to every other mammal. Being a bipedal organism, are we the exception or the rule? We are the exception because most mammals are quadrupeds, right? So now I want you to think about your cat or your dog for a second. So I want you to think about trying to find the muscles on your cat that are on the same portion of a person, okay? So I go from the cat paw, right, all the way up to this portion, and then it corresponds to the belly side of the cat. Do you see that? The muscles right here. So if I want to find the same muscles on a human, right, I either make the position like this in the textbook, which takes up a lot of room, or I make the position like this in the textbook, right? So you are going to find the same muscles, nerves, vessels, all of those here on a human that you would find here on a cat. Does that make sense? Okay, or any other mammal, any other quadruped mammal. Okay, that's why anatomic position is weird in humans. We will stop there for today, and I will see you guys on Thursday. If you need anything, feel free to email me.